Now going through it, I realize there's nothing to fear. You're in great hands, and you're going to be so thrilled with the outcome that you're going to wonder why you didn't do it sooner. My name's Valinda Nwadike. I've been married for 24 years. I'm a wife. I'm a mother of 3 children who are very active. I'm an OBGYN. I practice in Southern Maryland and in Virginia. I see about 40 to 50 patients per week. I have a condition that's known as fibroids or lyomas. I've had fibroids for about 15 years, and like many women, you just kind of deal with the symptoms. I put it off for years. I didn't have time. My kids were in school. I had to work. I denied that it was a big problem. My uterus had gotten so large that I couldn't conceal the fact that I really looked like I was 6 months pregnant. I went to a local doctor who told me my uterus was too big to do any other procedure other than to do an open procedure, which meant a big scar. I was horrified at the thought that I would be out of work for 6 weeks and had to have a big incision. So I called Dr. McCool at CIGC, and he said, "Valinda, you know me. I'll have you back at work in a week." I said, "Great, sign me up." Even though I am an OBGYN, you're anxious and nervous when you hear that you have to have surgery. It's very comforting to have a provider who understands what your concerns are and what your anxiety is about procedures. Dr. Danilyants was able to put me at ease. She's able to relate to your concerns with heavy bleeding or pelvic pain. She's also able to understand why it's important to do certain things to alleviate your symptoms. She drew exactly what the procedure is going to entail. She explained to me how long the procedure would take. She told me what my recovery would be like and approximately what kind of pain I would be in afterward, what kind of medicines I would have, and what to expect post-operatively. I had a dual-port GYN hysterectomy. Dr. Danilyants did the surgery, and she operated me on a Tuesday, and I was back at work on Friday. So it was 3 days. 3 days off work, and I was back at work delivering babies. I didn't have any pain, truly. I was able to walk to the car. I remember walking up the stairs to go to bed after surgery, and the next day I went out to dinner with my family and was able to move around. My scars are invisible. I looked right after surgery to see if there was going to be any big incision. I can't see them to this day. I love it. I can still wear bikinis. My colleagues were all shocked. They all wanted more information. I said, "Oh, I had this procedure done through 2 teeny ports." "Yeah, well, they used a power morcellator." I said, "No, they didn't. They didn't use a power morcellator." A lot of controversy with power morcellators. So my colleagues and I were excited to find out that there is none of that controversial morcellation that occurs. I refer most of my patients, if I have to send them out, to CIGC. What I tell my patients is it's a special laparoscopic technique and requires equipment that not all hospitals have. So they're able to remove your uterus without a large incision and without a lot of morbidity because of the technique that they use. This procedure gives you the best of both worlds. You have a small incision and the quickest recovery. Why wouldn't everybody want to offer that to their patients? I convince my patients to have this done here. I think this is a procedure that all women need to know about and all women deserve to have presented to them as an option. Within a week and a half, I was doing everything that I had done before the procedure. I mean, running, boot camp, swimming. Now that I've had it, I wish I had done it years before.